أكيد فعلاش بنعالج. Of course we can treat stroke. Today in 2018, with all the medical development, all the new technology, we have come to a point where we can treat it effectively, and we can make a huge difference in patients' lives. There are two kinds of strokes. The first one, which is less common, which is hemorrhagic stroke. It occurs in about 20% of the people affected with this condition, and that reflects an injury that happens from a blood vessel bursting inside the brain. There are many symptoms that can actually represent a stroke. Patients with hemorrhagic stroke will describe the sudden onset of severe thunderclap headaches or hearing a clapping noise in the head. They often describe it as the worst headache of their life. Then they become confused and their mental status becomes altered. Then they develop nausea and vomiting and severe sensitivity to the light. They cannot look out through the window into bright light. They have a tendency to close the curtains and to darken the room where they are. They often have stiffness of the neck, or what we call nuchal rigidity, and they ultimately slip into a complete loss of consciousness and deep coma. And then it is time to call for help. The second kind of stroke, which is more common, 80% of patients are affected, is what we call the ischemic stroke. And that specifically relates to a blood clot traveling to the brain, occluding an artery feeding the brain, and depriving the brain from the nutrients and the oxygen and the blood flow that it needs to survive. There are many symptoms that can actually represent a stroke. First, when you notice that the patient's face is asymmetrical, the face is drooping towards one side, the smile is crooked, or if they stick their tongue out, they cannot open their mouth as you would like them to do. Second is when the arm starts dropping down. You ask the patient to keep their arms up together and symmetrical, and they cannot. One drops down. Third is when the speech becomes garbled and you cannot understand it, you cannot understand what they're saying, or when they cannot understand a question that you ask them. And then it is time to call for help. That is where the acronym FAST comes from. A comprehensive stroke center is a medical facility where there is a group of physicians specializing in the treatment, the diagnosis, and the care of a stroke, as well as cutting-edge technology and equipment dedicated for the treatment and the diagnosis of stroke. Also, an intensive care unit specialized in the care of patients victims of a stroke. All of this 24 hours a day, 7 days a week, and 365 days a year. There is in fact a big difference between getting to a regular emergency room versus getting to an emergency room at a comprehensive stroke center. Because we save time, we have better expertise, we have all the technologies available to reach a good outcome in a patient suffering from a stroke in a comprehensive stroke center. At LAU Medical Center Hospital in Ashrafiyeh, we were able to assemble one of the most comprehensive stroke centers, if not the only comprehensive stroke center in the country. When a patient comes to the stroke center, specifically to the emergency room, he or she is quickly assessed by personnel in the emergency room. The emergency room physician will determine if this patient needs emergency CAT scan, and the patient is wheeled quickly to the CAT scan suite, whereby a CAT scan of the brain is obtained within a few seconds from arrival to the suite itself. The stroke neurologist will determine if the patient is a candidate for intravenous injection of RTPA, which is so-called the clot-busting drug. And if the patient does not respond or is not a candidate for the intravenous injection of the clot-busting drug, the patient is taken immediately on a stretcher surrounded by the physician, including the anesthesiologist, to the next step in the stroke treatment, which is the biplane angiography suite called Artiscu, which is also called the one-stop shop suite.
The one-stop shop concept is leaving out certain elements which are today routine in the stroke diagnosis treatment workflow to just make it faster. Because every minute, 1.9 million brain cells die in the case of stroke. And every minute you save, saves time, saves life.
We can do several things in that unit. We can look at the brain again. We can assess the damage again. We can pinpoint the place of obstruction or the spot of obstruction of the blood vessel and determine if we should carry the treatment further to perform emergency thrombectomy. Emergency thrombectomy consists of two different techniques that can in fact be complementary. The first thrombectomy consists of aspiration thrombectomy, whereby we navigate a large bore or a large mouth flexible catheter all the way inside the blood vessels and position it in the face of the clot or in contact with the clot. Once the aspiration catheter is positioned in contact with the clot, we use an outside machine to aspirate the clot from the brain and re-establish blood flow. If the aspiration thrombectomy does not work or is not efficient in re-establishing blood flow, we move to the second technology or the second technique called the Stent River. What is a Stent River? It's not a regular stent. It's a small, handmade, microscopic stent that we navigate inside the blood vessels and we get it all the way inside the blood clot that is obstructing the flow. It expands by itself. As it expands, it actually hooks the clot. Once the clot is hooked on the Stent River, and since it is on a stick or on a wire, we can remove it slowly, and as we remove it, we also remove the blood clot, and we re-establish blood flow to the brain. At the termination of the thrombectomy procedure, the patient is taken to the next step in the stroke treatment, which is the intensive care unit specialized and dedicated for stroke patients. What is a multidisciplinary stroke team? It's a group of physicians and specialists coming from different disciplines that work together as a team in unison, specifically for the management and better care of a patient suffering from a stroke. Most strokes are actually preventable. Eat a healthy diet, avoid red meat, avoid egg yolks, heavy cheeses, and deep fried foods. Do not add salt and avoid added sugars. Do not smoke tobacco. Get moderate exercise and make regular visits to the doctor and follow directions on all your medications.
The fact that we became part of the LEU family since 2009 has been strategic for our vital growth, directly affecting the quality of medical services. A great example of such improvements is the creation of this comprehensive stroke center, geographically located in the heart of Beirut, with a helipad where we are today, built as per international standards. We should not forget that the strategic partnership between the Red Cross and the Lebanese army in order to provide the civil population with a quick transfer to our stroke center is essential. Our plan is to become the reference center where patients will be treated with competence, safety, ethics, and compassion.
The brain is the most precious organs God has given us. It is the organ that makes us think, that makes us love, that makes us compassionate, that makes us intelligent, that makes us productive. So do everything you can to protect your brain. The best stroke you can have is the stroke that you've never had. I'd rather that you don't have a stroke rather than us treating it.